Hello, everyone, and welcome to today's webinar. And thank you for making time to join us today inside our red doors at the Bowery Mission to discuss the crisis of homelessness in New York City and the intersection of homelessness with racial, economic, and health inequalities. My name is Yafa Tella, and I serve as the co-chair of the Bowery Mission's Associate Board. The Associate Board is a group of young professionals and emerging leaders dedicated to leveraging their time, talent, networks, and resources to raise awareness and support of the Bowery Mission. If you'd like to learn more about our work, please visit bowery.org/associate board. The link will be in the chat. I'm excited to be kicking off this conversation today, and it's my pleasure to introduce you to our featured guest. G. Robert Watts, known as Bobby Watts, is the Chief Executive Officer of the National Healthcare for the Homeless Council, which supports hundreds of federally funded healthcare for the homeless programs and medical respite providers with training, technical assistance, sharing of best practices, research, publication, and active policy and advocacy programs working to eliminate homelessness. Bobby has 30 years of experience in homeless health services, beginning as a live-in counselor at the Bowery Mission's Tribeca campus, formerly New York City Rescue Mission. He has served on numerous boards, government appointment task forces, and work groups, and in February 2021, he was appointed as a member of the Biden-Harris administration's COVID-19 Health Equity Task Force. Bobby was also recently recognized in the National Journal in their report of professionals influencing the Biden administration, acknowledging the expertise of the National Healthcare Council for the Homeless Council, and highlighting how Bobby's faith drives him to work for social justice. Bobby's a graduate of Cornell University and Columbia University's Mailman School of Public Health, and from which he holds a Master of Public Health degree in Health Administration and a Master of Science degree in Epidemiology. He has earned a Certificate of Theological Studies from Alliance Theological Seminar in Nyack, New York. And joining Bobby in today's conversation is James Winans, and President and CEO of the Bowery Mission. James learned the realities of homelessness and the promise of life transformation through the college internship at the Bowery Mission that forever changed the course of James's life. Today, James serves as the president and CEO following 16 successful years of leadership at the Bowery Mission. James oversees the mission's expansive work across 8 campuses in New York, New Jersey, and Pennsylvania, leading a team of over 150 full-time and seasonal staff and a small army of volunteers to help transform the lives of men, women, and children experiencing homelessness and poverty. A native of Maryland and a graduate of Drew University, James and his family reside in Elmhurst, Queens. As a reminder, please feel free to use the chat function as a Q&A feature to share your thoughts and questions during the event. The event will be recorded, so if you want to rewatch or share, please keep an eye out for the video, which you will receive via email in the coming days. Without further ado, I'll turn it over to James and Bobby to kick off today's conversation.
Thank you so much, Yafet, and thank you for, as I said to you earlier, thank you for making this reunion possible. I just celebrated 16 years here on the staff at the Bowery Mission, and so a little bit over 16 years ago, I was seeking out some career advice, knowing that my next move would be in New York City, and I sought out this person I'd been introduced to named Bobby Watts, and Bobby both said, hey, you should really consider the Bowery Mission. I've worked there. It's a great organization. You're familiar with it as a volunteer, but also I was wrestling with, do I do fundraising? That doesn't sound fun. And Bobby pointed out that I might have some innate talent and skill there as well. So Bobby, it's so good to be back together with you today.
And with you too, James, and with all of your friends and colleagues at the Bowery Mission, which I hold in the highest esteem for the work that you've been doing for well over 100 years. And it's very kind of you to remember that meeting 16 years ago, so that way I don't have to remind you of it every chance I get.
Well, Bobby, this has been quite a year, and I know here in New York, we found that people experiencing homelessness were experiencing kind of an emergency on top of that pre-existing emergency. And I remember very clearly back in February of 2020, sitting down in the Bowery Mission dining hall with a guest and a reporter from a news outlet. And the reporter was speaking about this coronavirus that seemed very distant to us at the time, right? And she was saying to this guest who was experiencing homelessness, how do you expect the coronavirus to change your life? And our guest thought about it for a moment and said, I don't expect the coronavirus to change my life at all. People already treat me like I have a virus just because I'm homeless. Right? And that just illustrated to me that this was not going to be a simple situation as the pandemic then came to New York, and all of the public rhetoric said that we needed to stay at home. I think we here at the Bowery Mission said, well, there are thousands of New Yorkers who do not have that option, who do not have a home to stay in. And if they're not on anybody's radar, they're going to be on the Bowery Mission's radar. And so we changed our services. That story has been told in many other venues. But this pandemic has not had equal impacts, right? And according to the Coalition for the Homeless here in New York at the end of February, they reported that for sheltered homeless New Yorkers, the mortality rate from COVID was 49% higher than the general New York City rate. Staggering inequity there. And of course, now we are anticipating a new season, and there's heightened anxiety as we've put a lot of things in place, and now we're going to dismantle things like eviction moratoriums and isolation hotel rooms, that sort of thing. What is that going to mean for people who are experiencing homelessness? So, wondering how you're seeing. That's kind of the story from New York, but how are you seeing these impacts play out nationally, Bobby?
Yeah, thank you. And even before commenting nationally, just to commend the work of the Bowery Mission, how you have responded locally. And James, you may remember, I don't remember exactly which month it was, but I was asked by the Citygate Network, the Association of Gospel Rescue Missions, with whom the council has a relationship, to talk about this. And I interviewed you as well as the shelter director for the Nashville Rescue Mission, and the work that you had done in just moving very quickly from, as you said, for all of our existence, 100+ years, we've been serving in our dining room, and quickly to move that to the street and to work out social distancing. Distancing was just really phenomenal what rescue missions have done, what shelters have done in just response very quickly, and just really commend you. I was glad to be able to write about it as an example to other rescue missions to learn from your experiences. And what we've seen nationally is really been unprecedented in my years of working with homeless services. This is the first time in my recollection, and I've talked with people who've been doing this even longer than I have, in which we have much more clearly seen what the council has always said, that housing is healthcare, that the link between housing and health is so strong. And we have not given it sufficient attention as a nation. But you working with people living at the Bowery Mission, people coming off the streets, me working in healthcare for serving people on the streets through street medicine programs or in shelters. In my previous agency, where I was executive director, operated a shelter for mentally ill and medically frail women. We've all known this, but now we've seen the country know this. And what we've seen nationally is the impact of COVID on people experiencing homelessness is much greater than is widely understood. New York City is one of the few places that have good data, both on who is homeless and then the causes of death of people experiencing homelessness. And that's because there's a law that says New York City has to record the death and causes of death of people experiencing homelessness. So that's why we know in New York City, it's been 49% higher, and that's the age-adjusted mortality rate. And we're seeing that even in places where we don't have that much data, we are seeing elevated, it's not as clear-cut. Anecdotally, it supports that hard data coming out of New York. New York and LA are the places, and San Francisco have the best data on this. But what we've seen is that people who are experiencing homelessness may have been living on the streets. They were cut off from a lot of their things that allowed them to survive, much less thrive. Many soup kitchens, unlike the Bowery Mission, had to shut down because they relied on volunteers, many of them elderly, who were not able to continue coming in. It wasn't safe in the early days of the pandemic. As the nation shut down, places like libraries where people experiencing homelessness, especially in cold areas, relied on that as a place to not only to get off the street, but also to keep their phone charged so they can stay in contact. And as we move to telehealth throughout the country, that was a problem. Not only do people experiencing homelessness have fewer phones on average, even if they did, they may have less minutes. And then there's an issue of how can I keep my phone charged? So these were things that when we saw the nation respond, and I'm really extremely pleased that the CDC and HUD, for instance, really addressed this seriously, issued guidances for shelters and for people serving people who are living on the streets. How can they protect the health of this vulnerable population? Because it was predicted that they would die from COVID at higher rates for all of the reasons which you know very well. Can't socially distance if you're living in a shelter. You don't have control over that. If you're living in the streets, you don't have access to running water to wash your hands, which is one of the key guidances. You can't keep a mask clean if you're living on the streets. So what the CDC urged, and several cities followed suit, is they put hand washing stations near encampments, portable toilets near encampments, and most significantly urged that shelters decompress, reduce their census, socially distance, and then put the most vulnerable people in single room hotel rooms because the hospitality industry was devastated. There are a lot of empty rooms. They put people there. That saved lives. The death toll would have been much, much higher. So we see that the nation responding by recognizing the importance of housing on health by the CDC, the premier public health institution in the country, issuing a moratorium saying we need to stop evictions. That will be unhealthy for the nation. If we have that many people evicted, it'll be bad for them, but it also would be bad for public health. So really grateful that council can point out the successes of our community, the lessons learned, bring that to CDC, to have CDC and HUD enact some of our suggestions in their guidance to the country, and the example of places like rescue missions, like the Bowery Mission, are really been examples that would have made this pandemic much, much worse and deadlier for people experiencing homelessness.
Yeah, thank you, Bobby. And you've described some of the modifications that we have made here at the mission around hand washing stations, publicly available toilets. We've had toilets publicly available on our sidewalk now for 15 months. It's pretty incredible to think about that when we thought we were just creating a temporary solution for a lack of public restrooms. I want to transition us a little bit, Bobby, because you have expertise in this intersection between homelessness, health, and systemic inequalities. And today is the somber and sobering one-year anniversary of the killing of George Floyd in Minneapolis. You know, some people this year are acknowledging the impact of racism for the first time and the systemic nature of racism. And so why do you think it's important for us to consider that, the role of racism and its impacts, when we're considering this issue of homelessness?
I think it is so important. We would not have homelessness look the way it does, both in who is experiencing homelessness at elevated rates, nor I believe the size of the homeless population, if it were not for not only the history of racism in our country, but also some of the current practices that still have racist effects. So it is not an accident that African Americans make up between 12 and 13% of the general population in the country, but yet make up 40% or more of those experiencing homelessness. It's not an accident that Native Americans make up about 1% of the population, but anywhere from 3 to 5% of those experiencing homelessness across the country. And it's not, when we look at some of the practices in my lifetime, at least, and I'm not really that old, we look at slavery and Jim Crow as things of the past that no longer affect us. That is not true. So I was born in a segregated hospital in North Carolina, I moved to New York when I was moved to New York when I was very young, but my sisters remember going to segregated schools, segregated water fountains, and so forth. But most importantly, when we think about systemic racism, and that is really, we're talking about systems, not about anybody's individual bias or who's a good person or not, but looking at the systems in our society. They have been shaped by words that are contrary to the words of our Declaration of Independence, that all people are created equal. Our systems have argued just the opposite. So for instance, we know there is a history of redlining, that banks would not lend for mortgages in poorer neighborhoods, primarily African-American neighborhoods. But it wasn't the issue. It wasn't just the banks deciding this. This was federal law. This was federal policy and law that the FHA and the VA administration would not lend and would not back mortgages for homes to African Americans. Later, they said they would not back mortgages for African Americans if they were moving into a predominantly white neighborhood. So we see so much of housing, and so much is determined by housing. So one of the things is education, which in this country we say is supposed to be the great leveler of opportunities. But because of this, we have said that certain people will not get the opportunity, equal opportunity to own homes and build wealth. So they rent homes, they rent apartments. They generally can't accumulate wealth and build wealth, so they are poorer. And then we say public education will be largely determined by local property taxes. So what is supposed to be the great leveler is actually the great exacerbator. So wealthier communities can, and studies have shown do, spend more per student than those in poorer communities. When really, if we wanted it to be equal opportunity, we would say we were going to spend more for the poorer students so that they can get caught up with opportunities that their parents can't afford. But we do the exact opposite. And again, where you live historically and presently is greatly affected by one's race, particularly if you're African American. And of course, then we have the Native Americans with the reservations and poor education, poor housing there. And with George Floyd, this being the anniversary of his murder, which we can now correctly say, knowing that that is legally correct, we've drawn attention to unjust police practices. So another example of how homelessness and why we should pay attention to racism in this country. Federal studies and statistics show that whites and blacks use marijuana, possess drugs at roughly the same rates. But African Americans are 3 times more likely to get arrested for marijuana possession. And it's not because of usage, it's because of who gets stopped and frisked, whose car gets stopped, whose car gets searched. And when they search, they find they find higher rates of possession of drugs in cars that are driven by whites than blacks. But it's who gets searched. So these are police practices that are tied, again, often to where you live, whether you will be policed or not. And if you have a criminal record, you're much more likely to fall into homelessness. It's much harder to get a job. Our federal law leaves it up to each public housing authority whether they will exclude people if they have a criminal record. So coming out of prison, what should be subsidized housing available for poor people is cut off. So these systems are interlocking and build on each other that have created this racial disparities. And if we don't intentionally address it, we will miss it and we will keep perpetuating these systems and these results.
Yeah, thank you, Bobby, for that dose of reality and kind of how deep it runs right through the entire history of this nation, and certainly that last thing you highlighted for our guests who are experiencing homelessness. I mean, the daily interaction with police officers is one that's kind of fraught with all sorts of challenge, and we in the past year at the Bowery Mission have actually engaged the New York Police Department in conversation around, how do we engage better, particularly around issues of mental health, right? and there's another intersection there with mental health. But I do want to bring us to your work with the Biden-Harris administration. And congratulations on the recent accolade that you received that Yafet described, recognizing your faithful presence and your influence in this administration. But I don't know without kind of the way that these inequities have been highlighted in the past year, if we would have something like a COVID-19 health equity task force, right? Even this phrase of health equity feels very current and new, and you've been working on this for a long, long time. But it must be gratifying that it has some currency, some that is being highlighted in this administration. So now that you're on this task force, what do you hope to achieve, and what perspective are you bringing in particular?
Sure. And I just really want to say I'm grateful that the administration is focused on health equity, and also that they thought it important enough to bring the voice of someone with knowledge of homelessness to that discussion. And that's what I really view myself as, is I'm bringing the expertise and the perspective of the healthcare for the homeless, for the federally qualified health centers, for medical respite communities, and bringing that perspective. I'm careful to say I am not a representative of those communities, but I'm bringing that perspective because the goal is to look at what is best for the country and to make sure some perspectives and people are not left out of the discussion. So I can comment, one, I'm not speaking for the whole task force at all. I'm told to always say that. And I can comment on what we've addressed publicly. And what we have been focusing on each month, we're making a set of interim recommendations that go to the White House immediately, because some of these can help to promote health equity immediately. So the first month it was on vaccines. Last month it was on behavioral health, both mental health and substance use disorders. The meeting coming up actually next Friday, the 28th, is going to be on discrimination and xenophobia. So we are looking to make recommendations in short term that the administration can implement right away that can make a difference. And then at the end, which we're projecting will be around October, we will issue a set of final recommendations that will also include steps to better protect health equity in advance of the next pandemic. And I use that phrase very deliberatively. As an epidemiologist, we know that viruses mutate, that we will be hit with some, and we have to be ready. So it's not if, it's a matter of when. So we want to make sure that equity is protected. And when we say health equity, I think it's important to define the term equity. And I'm going to use the, it is that people get what they need to have a fair opportunity at health. So it really want to make sure people have a fair opportunity. So in this pandemic, we've seen that inequities in who gets infected varies based upon class and race. The poorer you are, the more likely you are to live in denser housing, in an apartment building where you share common spaces. The more likely you have to use public transportation. The more likely you work in an essential industry where you don't have the luxury of staying home and doing your work from home. If you work in a meatpacking industry, if you're a home care aide, those things are more likely to be people who are poorer. And in this country, that also means a person of color. So we want to make sure that they have an equal opportunity to be protected and to get the benefits of the vaccine, of getting tested, of getting PPE when they need it, that we would not be exacerbating inequities that exist in the face of this pandemic that affects the whole country and in fact the whole world.
Yeah, and thank you for highlighting the fact that it's often the essential workers that can be poorer, right, by percentage. And we had that experience in our in our residential programs where we have clients who are working and we're going to work in these essential fields and then coming home to a residential program at the Bowery Mission.
Yeah. So James, one of the things I admire about the Bowery Mission, and when I was working at the New York City Rescue Mission, they weren't one organization, but even then, and this is 30 years ago, the Bowery Mission was really in the lead of working with government, receiving government funding to run that Point Avenue D. So I want to ask you, how do you think government organizations and private nonprofits like the Bowery Mission can effectively work together to tackle crises like the one we are currently still in?
That's a great question, Bobby. And I think it's been a point of learning for the Bowery Mission over the last year and a half, because we actually ended our main grant with the city in about 4 years ago at Avenue D. And so the Bowery Mission has been privately funding the work through the generosity of donors who give so generously to support the work of the Bowery Mission. So we have not been at the government table with our hand out for several years. And so we entered into this pandemic situation and discovered that we really needed to redevelop and re-engage so that we had stronger and new collaborative ties with city agencies, with government, the Department of Homeless Services, the Department of Health, the Mayor's Office, New York Health and Hospitals, because there really is this public health expertise, this field that you work so faithfully in. A lot of that expertise, a lot of that information actually lives in government entities, and we needed to be able to access that guidance, be able to access that information. And in the beginning, we were a bit left out of the conversation because we weren't seeking grant dollars. But I'm just pleased to say over the last year and a half, we have been able to engage and build those relationships and have seen them extraordinarily fruitful. The scope of this homelessness crisis, I'll call it a crisis, is large. It takes a lot of resources. It's going to take all of us to solve it. And so public actors, public agencies have a role to play. We believe that private agencies like the Bowery Mission have an important voice to offer as well. So, and to that end, as the Bowery Mission and others maybe think about advocacy in a new way, what are the structural changes that you believe, Bobby, are needed for communities to advance health equity and economic and racial equity as it relates to health, as we prepare for, to the point you just made, future health crises?
Mm-hmm. Yeah, thank you. I mean, there's so many levels on which I can address it. One, what can organizations do, and what do we need societally? So I will talk about one area where they overlap, and it may even be uncomfortable. But one of them is just to collect data on race and ethnicity in our programs. And though we may say, we're going to treat everyone the same, and I believe that is our intent, it is really important to see is that the effect, and who are we serving? Are there gaps in whom we're serving? Are people having the same outcomes based upon their race and ethnicity? And if so, are there things that we can do about it? So I think there are some things, certainly from a healthcare point of view, that the government should mandate. That with, like, one of my big things is with the vaccines, we are supposed to be capturing who is receiving the vaccine so we can see if there's equity. Over 40% of the data with the federally provided vaccines is missing on race and ethnicity. Someone says that is a form of oppression, because if you can't identify a problem, you can't solve it. And this can also be almost willfully saying we don't want to see if there's a problem, so we don't want to deal with it. So the other thing I will just say societally, and I'm coming from the point of view that healthcare and housing are human rights. They are needed for life. They are needed for people to reach their full potential, to be able to pursue life, liberty, and happiness. These are things that are human needs, and a country as rich as ours should provide that. We are the only wealthy industrialized nation that does not view healthcare as a right and housing as a right. And if we were moved more towards that, that alone would help to address inequities by making sure people have the basics of what they need to live a healthy life. And that would also help to reduce race inequities, because so much of it is caused by our racist practices, past and present, and so forth. It also, just looking at one concrete thing that we can do, how we subsidize, we say we don't have enough money to subsidize housing for everyone who is poor. Right now, only 1 out of 4 households that meets the federal definition of needing federal assistance receives it, because we don't fund it. We fund HUD at about $50 billion a year in round numbers for those programs. But the amount of tax expenditures that we write off, even after the tax change of 2017, is in excess of $200 billion to promote home ownership, in the form of people writing off the interest, deducting that from their mortgage. So this reversal, it was the opposite before 1980, where we were giving more to help poor people stay in housing so they have the basics, and we have reversed that. So we clearly have enough money that we can do it, but it's been our priorities as a nation, set by Congress, set by every administration since 1980. So it's not a partisan, a blue-red issue. This has been a failure of ours as a country, where we are giving much more income, wealth, more subsidies, tax-supported subsidies for those who don't really need it. It's not going to determine whether you get a house, roof over your head or not. It will determine whether you get a bigger house or not. But yet we're not providing the basics for poor people. If we would do that, then we could move a long way towards improving the health of this country, the productivity of this country, and reduce inequity. And I could go on about healthcare. And moving from New York, which has always had a rich program of saying single adults can receive Medicaid, and you know how important that is for those that you're serving to be able to get their health needs addressed. There are still 12 states in this country, and I moved to one, Tennessee, 4 years ago when I took this role, that has not expanded Medicaid. And for someone who is experiencing homelessness, a healthcare for the homeless program will serve them regardless of ability to pay. But when it comes time to referring them for psychiatric care, for substance use care, for a specialist, we don't have it. So we need to do, we can, should, and must do better as a country in helping people get the healthcare and the housing that they need.
Bobby, we've been talking a lot about things that have been impacting us for a long time. What about this specific moment, as we kind of see the end in sight of the acute phase of this pandemic? What challenges do you think still lie ahead, and how are you preparing for those challenges?
Yeah, thank you, James. That's really is a big topic of us as an organization at the National Healthcare for the Homeless Council. How can we prepare our healthcare for the homeless programs, medical respite programs, and really the systems in which they operate to not return to the old normal? How can we create a better normal? One of the areas is we really do want the gains that we have seen in saying we need to protect the health of people experiencing homelessness. If we've said it's not good for a medically frail elderly person to be in a congregate setting during a pandemic, the question is, when is it good for them? Should we not continue for those most medically frail, find ways to protect their health until we can get them into housing? And I do believe that is the answer, housing. Until then, how can we keep them safe? Should we keep these motel rooms? Should we keep other things that we've created? I mean, some of these are just so basic, if we've said in a pandemic, we need to protect the health of people in encampments, and again, they should be in housing or shelter, but until then, by giving them hand washing stations and porta potties so that they can practice safe hygiene and reduce the risk of infecting each other, why should we ever take those away? So just the very minimal gains, how can we make sure that they are contributing? But our big picture really is we really want to advocate that the government returns to the level of funding that it did in 1979, when there was a housing voucher for every poor family, that we return to that. That would be a game changer. And that would really, really be it's important now that we've made that link between health and housing, that we build upon that and help to make that the norm instead of the exception. And I want to ask you, James, as I asked you this when I interviewed you for the article. I said, what do you see changing? And you had some, what do you see continuing after the pandemic? And that was maybe 7, 8 months ago, maybe more. And so I just really want to ask you, what challenges do you think lie ahead, and how are you preparing for those at the Bowery Mission? What lessons will you carry forward after this phase of the pandemic?
Yeah, great question, Bobby. I do feel like we're in that season as we come out of the acute phase of the pandemic to kind of look back and look forward, right? And so, you know, the economic impacts of this pandemic are going to continue to be felt. I talked to a lot of people who have experienced their wealth increase during the pandemic, right? And we just talked to a lot of supporters who say, my investment account is looking good, my savings account is looking good. I haven't been able to spend money the way I'm used to. The markets are up. But this pandemic has certainly had the opposite effect for a lot of folks. To your point, right now, we have a lot of folks in rental apartments who the landlord has not been allowed to evict. We have a lot of folks experiencing homelessness in hotel rooms that have been subsidized. And so, how do we acknowledge that this has kept people safe, that this has kept people healthy, you know, as we insist on unwinding some of these policies and practices? What impact is that going to have on folks? You know, we need to be paying attention to the intersectionality, to use that word, of homelessness, right? It's not just about poverty or access or education or social services or addiction, mental illness, trauma. This is a multifaceted experience for people. No two stories are alike at the Bowery Mission, and so that's why we have continued to focus on individualized care. You know, what is your story? What are your goals? You know, what challenge are you overcoming, and how can we join you in that? You know, but I think we're better prepared than ever. We, you know, our staff have been heroic. They have shown up every single day without fail to make sure that our services did not miss a beat, that we were offering life sustaining services, life transforming services every single day. And I think that things have been forged in this team around teamwork and problem solving and ingenuity that we're going to carry forward into the next season. I think our focus on health and safety will be one that carries forward no matter what the health challenge is. And then, you know, we have seen unprecedented support from people who said, how can I help? And I think that, you know, we are just so grateful to the people, to the businesses in the city who said, how can we lean in? How can we support? And so as we transition into this next season, we are going to see these new challenges emerge, and just want to encourage our supporter community to continue to stand with us as we stand with our neighbors who are experiencing homelessness. So we do have a couple questions here as we have about 5 minutes left. Someone in our audience submitted a question about how people experiencing homelessness are able to access vaccination. And I know here at the Bowery Mission, you know, a lot of the way that vaccinations have rolled out up until this point, and it's getting better, were, you know, log on to some website and sign up to get a vaccine at a place you've never been before, with people you've never met before, in perhaps in a language that's unfamiliar to you. I mean, these, I'm describing kind of the earliest, you know, as our guests became eligible for vaccination, that's how you went about getting a vaccination. And there were a lot of barriers in that, you know, the technology barrier, and perhaps the language barrier, the trust barrier of going to somewhere you've never been before with people you've never met before to get a vaccine in your arm. What are you seeing, Bobby, about access, equitable access to vaccines?
Yeah, this has been a big problem. And I didn't fully answer the question about what I hope to bring to the task force. And one of them is recognizing the importance of housing, collecting that data, stratifying, looking at it, but also the need for tailored solutions, just as you said, what works. As we said early on, a person experiencing homelessness would not go to a mass vaccination site at Shea Stadium or Yankee Stadium. That wouldn't work for them. We need to bring the services to them and tailor it to them. From a focus of equity, and again, when I talk about race equity and combating racism, I really want to emphasize I'm talking about at the systems level, not any individual person. So one of the things we've seen as far as equity early on when the vaccines were in short supply is that the CDC issued guidance based upon the National Academy of Sciences, Engineering, and Medicine that used a social vulnerability index to say which populations, which areas are at greatest risk and should be prioritized for getting the vaccine. People experiencing homelessness were pretty high up the list because of their poor health, living in congregate settings, and the likelihood they would get infected, and then it would lead to bad outcomes such as death, which we're seeing. Some cities and localities and states said, we're not going to use that. One of the most egregious examples was Dallas, where they said, we're going to use this and place the first vaccination sites in the hardest hit areas, which were largely poor, Black, Latinx. And the state said, if you do that, you can only use age. And if you use the social vulnerability index, we're going to withhold all of your vaccine supplies for the whole city. So, you know, it's hard to say how that is. That's not based on science. So we need to get the politics out of this as much as possible and rely upon the science for risk. And it should be local public health data, not local political concerns. And that's one of the things I have argued at the task force. And for vaccines, what we need to make sure happens in the next pandemic, that we are letting true risk define who gets it first.
Thank you, Bobby. Thank you for that. Well, I just want to thank everybody who's we've got a great crowd here on the call, and unfortunately our time is coming to an end. And there is a question, a perpetual question here. You know, how can I help? And so I would just encourage everybody on this call who is inspired to step in and help, to get involved, to get engaged, to reach back to whomever invited you to this event. You know, likely somebody on the Bowery Mission team that you have a relationship with, or maybe somebody at work who's a volunteer leader at the Bowery Mission, and get with that person and say, you know, I'd love to get more engaged. You know, I've heard what Bobby had to say. I'd love to be volunteering, advocating, giving, whatever is on your heart to do. To take action, to think about what is that one action that I'm going to take as a result of participating in this webinar. It's been interesting, it's been informative, but let's allow it to move us to action and take the next step. So thanks for thinking about what that next step is, and thank you, Bobby. Thank you for taking time out of your day all the way from Tennessee to be with us here in New York today and to illuminate some of these issues for us. Really appreciate your time.
It's an honor, and especially with people of faith, to talk about how our faith is driving us to be concerned, to care for others, and also to care for social justice. So I appreciate the honor.
Yes, yes. All right, well, thank you all.